Lately, I've been thinking a lot about senior dogs living on the streets. It's tough enough for young dogs to survive out there, but for the seniors, it's a living hell. We have an elderly gent at the shelter, a blind Cocker Spaniel, who was abandoned to the streets by his family. Can you imagine how terrifying that must have been for him? It's heartbreaking watching confused and frightened family dogs in this situation. Unfortunately, it's very easy for folks to dump their dogs on the streets when they no longer want them. One of our patients is a dog called Jude, who was referred to us by a dear friend, an animal lover. Jude had been living on the streets almost 300 miles away, and he was in trouble. He was in need of a great deal of help. But this old gent was in a terrible state. He'd lost the use of his back legs and was taken to the local vet by his community carer. Not all vets are created equal in Turkey, something we will talk about later. And seeing a single bullet on the x-ray, the vet there thought that was what was causing the problem. Bullet removed, Jude was discharged into the care of his community carer. However, his condition did not improve. I sent Dr. V Jude's x-rays, and we could see that there was a mass in his abdomen, a fracture to his hip, and something not right with his spine. Worryingly, we also saw that the position of the bullet had played no part in Jude's leg paralysis. I have to say, I was fuming, and even more so when I discovered that Jude had been discharged with no pain relief. When Jude arrived at the clinic, he was being eaten alive by maggots. Our vets had to shave his entire coat to pick the maggots out of his flesh. His skin was burnt from the excrement. His eye infection was completely out of control. His hip was fractured, his spine fused, his kidneys were damaged. He had bladder and bowel problems and was suffering from dementia. We got to work on the eye infection, fixed the hip, removed the maggots and soothed his skin, gave him a catheter to make him more comfortable, and when he was ready, some passive physiotherapy. Jude could not completely recover, and he needed hospice care. Such a thing does not exist in his country. Dogs like Jude pass away alone and in great distress. Well, I'll tell you what, we are changing that, and we need your help. Please tell your friends about us. We need more followers. We are one of the poorest organisations in the UK, but we do huge things. Can you imagine what we could achieve if we had more support? So please support us for dogs like Jude. I've been Michelle, he's been Jude, and we'll see you again tomorrow for another dog story.